Hi, my name is Kayla Jassanis, and my topic is stress and anxiety disorders. Stress is defined as a nonspecific and predictable response by the body to the demands placed upon it. This can be due to family, work, school, anything along those lines, as well as a job. 7 out of 10 adults experience stress daily. Stress has also been linked to several mental and physical conditions such as anxiety, asthma, depression, cardiovascular disease, chronic pain, stroke, and even certain types of cancer. Now, this organization called Stress in America does a survey every year, and this year they showed that most people rated their daily stress an average of 5.1 out of 10, with 10 being the highest amount of stress. And last year was at 4.9, so you can see that it has increased, with work and money being the top two sources of stress, which can kind of go hand in hand because financial burden can place a lot of stress in someone's life. More than 1/3 reported that their stress has increased over the past year, and 40% of these people who said their life was stressful tend to eat unhealthy food, which can lead to further problems. 31% even admitted to skipping meals, which happens a lot of times I see in school where kids will have early morning classes and they'll just skip breakfast in order to be on time for their class or to sleep in a little bit longer. Since 2014, 16 more percent people were diagnosed with depression due to stress, and this can be seen as a good thing and bad because it shows that more people are going to see a specialist and are being diagnosed, whereas it's also not so good because there's more diagnosis this year or since 2014. This is just a general overview of how stress affects the body. First and foremost, the skin. There's problems like acne, psoriasis, and eczema that can there can be breakouts due to stress. It also affects alopecia. I have someone in my family who was diagnosed with alopecia, and when he gets more stressed, his hair starts to fall out. So you can see that it does happen. With your stomach, it can cause diarrhea, constipation, irritable bowel syndrome, and also with joints and muscles, it can cause aches and pains, maybe some swelling, and also tightness in the shoulders and the back. And with stress, a lot of time comes anger, depression, irritability, and lack of concentration. It can also cause anxiety and panic attacks. As for the heart, stress increases heart rate, increases blood pressure, can increase the risk for heart attack and cardiovascular disease, and also higher cholesterol. There's 2 different types of stress, the first being acute stress, which is that short-term stress that kind of goes away, but it can come back. It's the most common. It's due to future or past events. So if you have a test coming up and you're stressed out about, getting a good grade, or it can be from getting a test back and seeing that you've gotten a poor grade, so you start to worry about that. Acute stress can be beneficial because it can be motivational. If you do have a test coming up and kind of push you to study a little bit harder, but too much can cause you to, maybe have a panic attack or something along those lines. For the emotional aspects of acute stress, a lot of times it's irritability, anger, depression, and frustration, whereas some physical aspects could be headaches, neck pain, constipation or diarrhea, and even heartburn. The other type of stress is chronic, which is kind of that grinding daily stress that never goes away. It can be from, hard family life, struggling marriage, financial issues, which can put a burden on the family. It can also stem from a traumatic event in early childhood, such as a car accident, even sexual abuse, anything along those lines. This is the type of stress that can possibly lead to suicide, violence, heart attack, and even a stroke. The best thing to do in order to manage stress is to exercise. Exercise has been shown to increase one's ability to concentrate, so that can kind of help focus on the tasks you're completing at hand instead of worrying about the future. Exercise can also provide a break, from life, from school, from your job, even from your family, just kind of give you that out. It can also improve self-image, and when you improve your self-image, you're improving your confidence, and the more confident you are, the more you feel like you have control of your life, so that can kind of reduce the stress. Exercise has also been shown to reduce fatigue by increasing energy, so you're not feeling like that whole you just want to go to bed all day. And it also produces endorphins, which are the brain's feel-good neurotransmitters, so they can increase mood and kind of help make you feel better. These also help regulate your sleep pattern. So therefore, by having a normal sleep pattern instead of oversleeping or having difficulty sleeping, you have a normal pattern, so that can reduce stress as well. Anxiety is defined as an emotion characterized by feelings of tension, worried thoughts, fear, and physical changes. Anxiety disorder is when it's diagnosed. It's kind of like this elevated feeling. There's also recurring intrusive thoughts or concerns. Anxiety is the most common form of mental illness, and a lot of times it goes undiagnosed because people are afraid to come forward due to the stigma. Anxiety can be disabling because it can impair daily functions. Certain types of anxiety can cause people to avoid certain situations, and there's many different forms of anxiety, which I'll go over a few. Also, anxiety is twice as likely to affect women than men. There hasn't been any research to explain why, but the results are there, and it shows that it does affect 2 times as many women. Anxiety affects 40 million adults overall, with 6.8 million being affected by general anxiety disorder. With panic disorder, there's about 6 million. Social anxiety is 15 million, and specific phobias is about 19 million. Worldwide, 1 in 9 people has had an anxiety disorder at some point in their life, whether they went and were diagnosed or not. And only about 1/3 of these people receive treatment, which is kind of sad because treatment is so readily available, but yet people are afraid to come forward. Anxiety disorders can develop from genetics, brain chemistry, personality, and life events, such as the loss of a loved one, or a car accident, or sexual abuse. This is just an overall chart, kind of like that normal fears that everyone experiences at some point in their life, in the early stages of their life. Where I mentioned earlier that separation anxiety is going to be the infancy and when you're a toddler, when your mom leaves and you start to get really upset about it. And school anxiety and performance anxiety is from that age of like 6 to 12, when you're kind of getting used to being on your own. So just a couple overviews of the different forms of anxiety, different disorders. With separation anxiety, it's the fear anxiety about being separated from attachment figures. So like I mentioned, a toddler being separated from their mother and stuff along those lines. That has to be on for about 4 weeks before being diagnosed. It's more common in children, and it can result in nightmares and physical distress. Selective mutism is when someone fails to speak in social situations because they're afraid of the pressure of the amount of people involved in the situation. This also has to be going on for at least a month before being diagnosed. Specific phobia, I'm sure everyone has heard of. That's that irrational fear of something, but it's not just being afraid, it's elevated fear, so it'll actually stop you from doing something. Social anxiety disorder is the fear or anxiety of social situations, where people fear that negative judgment. So a lot of times it's common in adolescence because everyone's going through the awkward stage, they're afraid of what everyone's thinking. And a subset of social anxiety is performance anxiety, when you're afraid to public speak or perform in a play, again because you're afraid of that critique that could possibly happen. With panic disorder, there's recurrent unexpected panic attacks, and once that panic attack happens, then there's reoccurring concerns about more panic attacks, so you constantly are worried about it. So it's kind of like that never-ending cycle, and it persists for about a month before being diagnosed. Agoraphobia is marked by the fear, anxiety of feeling trapped. This is what will cause someone from not going out in a social situation because they fear they don't have an escape, so they're going to be stuck in that situation. Generalized anxiety disorder is that overall general worry. It can change from day to day, and this has to be going on for at least 6 months for a diagnosis. This physical symptoms and signs can be fatigue, restless muscle tension, sleep disturbance, and difficulty concentrating. A couple causes for anxiety, as I mentioned before, childhood maltreatment, so sexual abuse, physical punishment, and that can kind of go hand in hand with overprotective and overly harsh parenting, such as hitting your child for doing something wrong instead of just telling them that it was wrong. Family history of mental illness, and also low socioeconomic status. Financial issues can put a burden on the family. In order to be diagnosed, one has to go see a family doctor, where they perform structured clinical interviews and ask questions such as how would a certain situation make you feel, and stuff along those lines. The most common form of therapy treatment is cognitive behavioral therapy, and it's been said to be the most effective. It's short-term, so it only lasts about 10 to 20 weeks, and it works by setting mini goals to accomplish, and it teaches different coping methods and safety procedures. This can be especially helpful for people with different phobias and social anxiety. As for medications, there's antidepressants and also selective serotonin reuptake inhibitors, which block the reuptake of serotonin, which means that there's more serotonin readily available for the body to use, and serotonin is responsible for mood, so it can uplift your mood. Benzodiazepines are short-term, and they promote relaxation and reduce muscle tension. Exercise and anxiety can be difficult because anxiety does create barriers. For social anxiety, people are afraid of judgment from others, so especially if someone's overweight and the anxiety, and they're going into a situation where a lot of people are in the gym, they're going to be afraid of what everyone's saying. But with exercise, you can gain confidence by increasing your self-image, and you can also gain confidence by meeting little goals that you set for yourself, so that can kind of help someone adhere to a program. It's also beneficial due to the social interactions that it can kind of be a form of therapy by slowly increasing the amount of people or like the environment that you're exercising. Now, Kelly is a 21-year-old female. She's a junior in college and is studying chemical engineering, so she has a heavy workload. Kelly played soccer in high school but has not played since her senior year. She's not really exercised much due to her vigorous schedule, and by the end of freshman year, Kelly was actually diagnosed with generalized anxiety disorder. Her mother was diagnosed with generalized anxiety disorder when she was 25, so it does run in the family. Kelly lacks sleep and often has muscle tension throughout her body due to her anxiety. Kelly's goal is just to improve overall fitness, and I can just show you a couple things right here. She's at risk due to her BMI being 30.5, so it's above that 30. She's also at risk because her blood glucose levels are above 100. So Kelly's at moderate risk since she has 2 or more risk factors, but she is asymptomatic. She also has a sedentary lifestyle. Her blood glucose levels are high and her BMI is pretty high. So overall, Kelly wants to improve fitness. She wants to lose weight and ease that muscle tension. And this exercise will reduce her anxiety and hopefully improve her sleep patterns. For testing, I would do 1RM test just to measure strength. We can do like a squat or a bench press. We could also do body composition for skin folds to measure her weight loss and muscle tone, and just a 12-minute run walk test to kind of see where she is aerobically. For her warm-up, like as every other warm-up, you want to do it before each workout, just a light intensity, 5 to 15 minutes, depending on what you're doing. You want to just have dynamic movements. You want to make sure you incorporate the upper body, so you're not just walking on a treadmill. You want to do stuff with like jumping jacks and kind of get those arms going as well. For her aerobic prescription, you want to start with I would start with about 3 times a week and maybe progress to about 5. For the intensity, you want to start at about 50 to 75% of heart rate reserve. But since she has not been exercising, I want to start with a lighter intensity. Again, for time, about 30 to 60 minutes each session. So when you first start with about 30 minutes, then ease your way up to 60. This can include like walking, cycling, swimming, anything to incorporate the large muscle groups. And the big thing with people with anxiety, a lot of times the issue is that they'll just quit the program or they don't want to do it. So you just want to set little goals, so then that way they can feel, they're accomplishing something, and to make sure they, that whole reward thing, make sure that, maybe go out to eat or something if you do accomplish your first goal. For resistance, at least 2 times a week in the beginning. Maybe actually even start with 1. For intensity, I do about 55 to 80% of her 1RM. It should allow to 8 to 10 different exercises, and we want to work on muscle strength and a little bit of endurance, so I would do about 8 to 12 repetitions. Basically, I would do free weights, resistance bands, machines, anything, as long as I change up the program. Because once you have a steady program, people are going to get bored. They're not going to want to stick to it. So just anything to change it up. And also flexibility is key, which would be about 4 days per week, eventually daily. And you want to hold it to the point of tension. So it's about stretching, yoga, tai chi, anything to help with breathing. Because breathing is known to reduce anxiety, if you can control that. So overall, stress and anxiety are very common regardless of what people say, and there is treatment available, but exercise is a great way to manage stress and anxiety. And I believe that confidence is key. And these are my references.